Welcome to the Midwife Pip Podcast Bitesize, the home of all things pregnancy, birth and motherhood. This week, I'm sharing with you some golden moments and nuggets of information that will change your pregnancy, birth or postpartum journey for the better. You'll find the full episode linked in the description. But for now, wherever you are, let's dive into some short but transformative chats. Today's clip is from episode 44 with expert Clare Bourne, chatting about pelvic girdle pain in pregnancy. In this clip, we discuss how pelvic girdle pain is not caused by what many believe causes it, and how understanding the true reason behind it means you can improve and even resolve pelvic girdle pain.
The demand is just higher. You know, your kids are probably up at 6 o'clock, if not earlier, every day. You're trying to probably juggle work, childcare, everything else. There's much less time for yourself. So, you know, when you start looking at that and just the general stress on the body and the system, you can start to think, okay, well, maybe that is why we start experiencing pain in a different way. So, yeah, it's complex. And I find it hard to explain because actually we don't know. And I think it's really important as clinicians, we admit we don't always know. But we must stop saying to women it's because their pelvis is unstable, because they're weak, because, you know, it's truly a hormonal driver. We're not saying that hormones don't have any play, but we're just saying that we can no longer blame it fully on being a biomechanical, hormonally driven condition, because that's no longer supported. But we have to be open to say we're still learning the whole picture.
Yeah, that's a really good point, Claire, isn't it? It's so multifactorial. It's not kind of as simple as that. And I loved what you were saying about that mind-body connection when it comes to pain, because that's something I can completely relate to. I teach it in my birth prep classes. The idea that if you get into this anxiety, fear, tension cycle, then it exacerbates pain. And that's exactly what we're trying to work against in labour. But actually, I guess it's the same for any type of pain in life, be that your pelvis, a headache, you know, labour, it kind of all plays into the same.
Of course. And obviously when you have pain, you naturally want to stop it. So, you know, when I recently had quite bad back pain and I just didn't want to move because I knew it was going to cause, I was going to experience my pain. Actually, I equally in my physio brain knew that movement is actually good. And what my body actually needs to do is move. Finding what that movement is and how we get you to do that, that's a whole other topic. And this is where individual care is so vital, because one woman with pelvic girdle pain or back pain and another woman, their goals will be different. You know, some women it will just be like, I just want to take my kid to the park and get through this pregnancy. And for someone else, they might be like, I just want to be able to keep doing my workouts. You know, I can't, you know, for my mental health and my well-being, I just want to be able to do a proper workout. And so working with those two individuals, and equally some might feel their pain in their pubic bone and some might feel the pain around the back of their pelvis. So this is where we have to say, okay, look, we need to assess you. We need to see what you're able to do, work within your parameters. And if you continue to help your brain to know and your systems to know that movement is good. But often what happens is because women aren't supported, it's this like, well, that's just the way it is. Their pain increases, their mobility and ability decreases, and they're just left with this such lack of support. Whereas actually we often see, if we see women earlier, and actually, as you say, that kind of waddling as you did in the introduction, you know, we get into these patterns which equally then can set off other problems, because that's not really how our body's designed to move. Very helpful at getting us from A to B at times, but you know, there's always this kind of slightly knock-on effect. And actually sometimes when we break that down, or the earlier we catch it and we say, right, let's put in some strategies now, it's amazing to see that women actually, though you think the pain is just going to go up and it's just going to get worse, actually for some women we can actually get it to go down and then be absolutely fine. So the frustration is though that help is not available, I'd say, widely across the NHS for all women. And if you think about the amount of women, if we're saying about 50% of pregnant women needing that support, I mean, that's vast, isn't it? And sadly, the NHS just cannot at the minute resource that. But I equally think part of the problem is the narrative that we still have across healthcare professionals that this is not a treatable condition, and it is.
That's really good to hear, Claire. And I think that ties into so many women's health kind of issues, doesn't it? That it's kind of not easily accessible, but that's a whole nother rant for a whole nother day, because we could be here for hours if we get into that.
So true.
So when it comes to kind of pelvic girdle or back pain, is there anything that we can do either when we're in that preconception period or during pregnancy itself to try to help reduce our risk of or prevent it kind of creeping in?
Yeah, I would say definitely if you know you've got a history, say, of any hip condition or hip injury or back injury or anything like that. I'm actually seeing a lot of women come to me with this being like, I know I've got this history and I'd really love to try and think about how I'm moving now. What can I do? And I think that's also true for between pregnancies as well. So say you've had like a really hard first pregnancy and you're wanting to have another and you think, I just can't cope with that again. I've seen women who were on crutches the first time. They've come to me, say, that kind of year postpartum, and we've really worked very gradually on getting them stronger, helping them just to move better. And actually, a lady went on to have literally not a single bit of pain. She said she was just waiting every week to be like, this will be the week, this will be the week. And she went through a whole pregnancy with not a single bit. So there, again, we don't fully know. Exercise has not been shown from a strengthening exercise point of view in pregnancy to necessarily cure pain, which is again what we used to be, because we were like, okay, everything's unstable, the more we strengthen, focus on strength, will that equal decrease pain? Again, the research isn't standing up on that. Actually, what we're seeing more is actually, again, as you say, this sort of tension picture, that actually if we get women just moving more freely, and just doing movement, knowing that movement's good, it doesn't have to be truly focused on strengthening, that in pregnancy that can really help. We think we understand that probably between pregnancies, and I guess this would stand for before, some strength training can help in that time. And I've definitely seen that anecdotally with some of my clients. Again, I don't think it's just truly strength though. I think it's just movement patterns, and again, dealing with some tensions and how we hold ourselves and feeling confident to move. I think there's so, we view it as strength training, but really movement is movement, isn't it? And that's really powerful. So I think that's what I would generally say. Though, because we don't fully understand why, we don't fully have the answers as to who, I know 3 people who would probably do Pilates, and they might be like, I went into the pregnancy strong, and some still have it more than others. And that's because there are these multiple factors. But I think just being aware of it, maybe, as I say, seeing someone proactively if you know you have a history of any problems. And then I think just knowing early on in the pregnancy, if you are having any problems, just to flag it and get some help.
I hope you enjoyed this bite-sized clip, and why not go ahead and share it with others. If you want more, go back and listen to the full episode linked in the description. Before you go, please can you do one more thing? Make sure you've hit that subscribe button, as it helps me and the podcast reach out to and support even more women with crucial, expert and reliable information through the podcast.
I'm Laura.
I'm Lauren.
And this is Go Love Yourself. And she went, you're 26? I was like, size 26, yeah. And she was like, oh, right, that makes sense.
This is the show where we're learning to love ourselves a little more and taking you along with us.
I grew up never seeing anybody that looked like me, and that made me feel like not part of society, like almost like not a woman, because I just never felt like I fit in.
If you've got a relative that is mean about your body, Laura, what do we say to them?